In this conversation, I want to talk about adding $100,000 to your dental hygiene production without the hygienist working one more minute. Before I do that, if you've been listening to these conversations, and I hope you'll experience many of them, one of the things you begin to realize is that Levin Group uses a three-step method, which is setting targets, building systems to achieve the targets, and using value creation scripting to make the systems work better. One of the targets is adding $100,000 to $200,000 a year to dental hygiene production. Can it be done? We're doing it all the time. And how are we doing it? Well, the first thing is to recognize the importance of dental hygiene. 75% of practice production should come from the doctor, and 25% should come from the hygienist. This is critical because this is the one area where doctors can delegate production. Doctors don't have to do it. They don't have to be in the room. They come in for the exam. But 25% of the production pie in a dental practice is coming out of hygiene. Let's make that slice as big as we can. Makes perfect sense, right? Okay, so how do we do it? Well, the first thing is we want 98% of all hygiene patients pre-scheduled. We want them pre-scheduled. If a patient leaves without a hygiene appointment, we call them the next day. Then we use a method called the 3/3/3. They get 3 calls in 3 weeks to schedule their hygiene. They get 3 letters, hard copy letters sent to them, and then 3 emails. We're going to get them scheduled. Our clients have over 98% of all of their patients pre-scheduled for hygiene at all times. Number 2, you've got to have enough hygiene appointments. Practices get lazy about getting all of their patients pre-scheduled when they don't have enough appointments. I mean, why is a front desk person going to take the time to get people scheduled when they don't even know where to put them? And front desk people, and that'll be another conversation we'll have on the Levin Group website, but front desk people don't operate methodically. We want them to operate focused on revenue-producing activities. A lot of what they do all day is non-revenue producing activity. Getting patients scheduled is a revenue producing activity. So we have certain one-day rules, and every day one of the rules is any hygiene patients, that do not have a pre-scheduled appointment for their next hygiene will get a call that day. The day that they are not scheduled or overdue, they get a call that day. So number 2 is we have to have enough appointments. Number 3, we have to create value for the dental hygiene appointment. And we don't. It's a cleaning, it's a prophy, it's a prophylaxis. Those are words that do not connote value. They do not communicate value. We did a lot of testing at Levin Group, and what our clients refer to that hygiene appointment as is periodontal maintenance and oral cancer exam. And you have to say the whole thing. Periodontal maintenance is critical. Periodontal disease is rampant. Oral cancer exams are critical. The mortality rate for oral cancer has not dropped in many years. So we dentists are the ones that have to find it. And we need to begin communicating real value. So we changed the name to periodontal maintenance and oral cancer exam. The 4th step is to identify periodontal disease. 71% of all general practices do not probe or record pocket depths once a year. I'm not criticizing and I'm not judging. I'm looking for opportunity. I'm trying to access your growth potential. If you probe once a year, you will find that 40% of your active patients should be going through initial therapy and 60% of your new patients. Then those that are not where you want them can be referred to periodontists. Those that are can come in every 6 months, 4 months, or 3 months. Critically important information. The next step is to sell products. There's a real reticence by doctors about selling powered brushes and health rinse, oral health rinses and other devices for home oral care. And I don't know why we are so inhibited about this. Ophthalmology practices now have stores that are their glasses. I was down at Johns Hopkins Hospital, the #1 hospital ranked in the world year after year. They have the Wilmer Eye Clinic, one of the finest eye clinics on the face of the earth, and they also have a store that sells glasses. We respect them. We don't respect them less because glasses are being sold. Dermatologists carry lots of products. Plastic surgeons carry lots of products, and certainly, as I know from my dog, my veterinarian carries lots of products because I just had to buy him anti-inflammatories and avocado supplements, of which he isn't eating the avocado supplements. So if we carry products, one of our targets is that product sales should be going up every year. It's easy, people like it, they want to buy it right here, they're happy. And then the last step is for the hygienist to begin to identify dentistry, present it to the patient, close the case for the dentist to come in and finalize it. We are having doctors train their hygienist on what to look for, what's broken, what's decayed, what's cosmetic, what's implant, what's occlusal, and to educate hygienists so that they have the opportunity to present treatment to patients in the confines of the hygiene appointment to educate, motivate, and excite patients. 3 key words: educate, motivate, and excite patients. And then we can take these hygienists and turn them into case identifiers, case presenters, and they refer a lot of dentistry back to the doctor, all within the quality of care purview for the patient. So doctors can often pick up $100,000 to $200,000 a year of increased referred production from hygienists back to the doctor's side of the practice. I got a call from a friend of mine a few months ago who told me a story that he walked in the hygiene room. He was a client of ours at the time, and the patient looked at him and said, "I want 6 of those porcelain laminate veneers that Sally just told me about." Sally's the hygienist. He called me up. He said, "Roger, I told my consultant this story, but I wanted to tell it to you. This was terrific," because all I did was look back at the patient and say, "Great." I didn't confuse it. I didn't go into a long dialogue. I looked in the mouth. It looked like it could be done very well. I just said, "Great, you're a perfect candidate, and I'll be doing that case next week." And the hygienist had even gone down to giving the fees. So our hygienists have incredible potential. The hygiene area of the practice is one of the few areas where we can delegate production, we can leverage off others to help the practice grow financially. Everybody on the team is important, but this is a phenomenal opportunity to grow the practice. If we want to grow the whole pie, we've got to grow the 25% hygiene slice to a bigger production number. It's being done day after day by our clients all over the country, and you can do it too.